Have you ever thought about what happens when a patient's airway becomes difficult to manage in a healthcare setting? Well, let's delve into this. The concept of a difficult airway refers to the clinical situation in which a conventionally trained healthcare professional experiences difficulty with face mask ventilation of the upper airway, difficulty with tracheal intubation, or both. It's a situation that can occur due to various reasons: anatomical variations, injuries, diseases, or even certain medical procedures. This can pose a critical issue in healthcare because the inability to secure a patient's airway or provide adequate ventilation can lead to severe consequences, including brain damage or even death. Therefore, the management of difficult airways is a vital skill for healthcare professionals. It's not just about ensuring the comfort of the patient, but also about safeguarding their life. So, as you can see, a difficult airway situation is not just about the patient's comfort, but it's a matter of life and death. Picture this situation in an emergency room. It's a busy night, filled with the usual cacophony of alarms, calls for assistance, and the steady hum of life-saving machinery. Among the chaos, a patient is wheeled in, unconscious and with rapidly declining vital signs. The medical team quickly identifies the problem: a severe difficulty in ventilating the patient's airway. This is a real-life case that took place in an urban hospital, and it serves as a stark example of the challenges healthcare professionals may face in the midst of an emergency. The patient, a middle-aged man, was suffering from a yet-to-be-diagnosed respiratory ailment that had caused his airway to become severely obstructed. The emergency team, led by a seasoned doctor, immediately jumped into action. They attempted to intubate the patient, a standard procedure in such situations, but found it nearly impossible due to the level of obstruction. This was a difficult airway situation, in the truest sense of the term. The stakes were high. Every second counted. The team had to think on their feet. They decided to employ a seldom-used technique known as retrograde intubation. This procedure, though more complex and time-consuming than typical intubation, was the only viable option left to ensure the patient's survival. After several tense moments, the procedure was successful. The patient's airway was secured, and his vital signs began to stabilize. The team's quick thinking and effective management had saved a life that night. This scenario, while intense, is not uncommon in the world of emergency medicine. It illustrates the vast challenges that healthcare professionals face when dealing with difficult airway situations. From recognizing the problem, to deciding on the best course of action, and finally executing a complex procedure under immense pressure, the task is monumental. However, it also highlights the incredible skill, dedication, and resilience of our healthcare professionals. Their ability to adapt and respond to life-threatening situations is truly commendable. This case underscores the importance of quick thinking and effective management in a difficult airway situation. It reminds us that every second counts, and that the right decision at the right time can, quite literally, mean the difference between life and death. Now, let's move to the operating room. Imagine a routine appendix removal surgery. The patient is a 30-year-old male, physically fit with no known allergies or medical conditions. The anesthesiologist successfully administers the anesthesia, and surgery begins. But within minutes, the patient's oxygen saturation levels start to drop. The surgical team is faced with an unexpected difficult airway situation. This is not a rare occurrence. In fact, unanticipated difficult airways are a common challenge in the operating room. They can occur due to various factors like anatomical abnormalities, tumors, or even just the position of the patient on the operating table. In our case, it was the latter. The patient's position had caused his tongue to fall back, obstructing the airway. The team quickly recognized the issue. The monitors showed a decrease in the patient's oxygen levels, and his skin began to take on a bluish tint, a condition known as cyanosis. The anesthesiologist attempted to manually ventilate the patient but found it difficult due to the obstruction. Time was of the essence. The anesthesiologist decided to reposition the patient to relieve the obstruction. This action, while seemingly simple, can be a powerful tool in managing difficult airways. The patient was carefully repositioned, ensuring not to disrupt the ongoing surgery. Simultaneously, the anesthesiologist called for additional airway management equipment, a laryngeal mask airway. This device is designed to secure the airway during anesthesia and can be a lifesaver in difficult airway situations. The mask was carefully inserted, and the patient's oxygen levels began to stabilize. This event illustrates the importance of quick thinking and teamwork in managing difficult airways. The surgical team was able to identify and address the problem swiftly, preventing a possible life-threatening situation. The surgery proceeded without further complications, and the patient was safely extubated at the end of the procedure. As we can see, a difficult airway can complicate even the most routine surgeries. Next, imagine a scenario in an intensive care unit. In this bustling hub of critical care, let's consider the case of a patient with a difficult airway. John Doe, a 58-year-old man, was admitted with a severe case of pneumonia. John's health took a turn for the worse and he developed acute respiratory distress syndrome, a serious condition where fluid builds up in the lungs. Managing a difficult airway in an ICU is like walking a tightrope. The stakes are high and every decision counts. In John's case, the medical team had to make quick yet calculated decisions. The first challenge was to ensure adequate ventilation. They used a bag valve mask, but it was challenging due to John's facial structure and the fluid in his lungs. When initial attempts at ventilation failed, the team moved on to the next level of intervention. They attempted to insert an endotracheal tube, a common procedure in ICU to establish an airway. But John's airway was swollen and obstructed, making the process difficult. Time was of the essence. The team decided to perform a tracheostomy, a surgical procedure where an opening is made in the neck to place a tube into a person's windpipe. This would provide an airway and allow for the removal of secretions from the lungs. Despite the complexities and high-stress environment, the team remained composed, each member playing a vital role. Their expertise and coordination were key in managing John's difficult airway. The tracheostomy was successful and John's oxygen levels began to stabilize. The impact on John's condition was immediate. His breathing eased and his overall condition improved. This was a result of the team's quick thinking, technical skills, and their ability to adapt to the situation. But the journey didn't end there. The team continued to monitor John closely, adjusting his treatment as needed. Through diligence and precision, they managed to navigate the stormy seas of a difficult airway situation in the intensive care unit. This case study shows that managing a difficult airway in an ICU requires a high degree of expertise and precision. So, what are some common techniques to manage these difficult airways? Well, let's dive right in. First off, we have the time-tested method of intubation. This is a procedure where a tube is inserted through the mouth and into the airway. It's typically performed when a patient is unconscious or sedated, and it allows for better control of breathing and protects the patient's airway from aspiration. But the process isn't always straightforward. Sometimes, due to anatomical variances or other complications, intubation can be quite the challenge. Yet, with the right skills, equipment, and patience, it's a technique that has been proven to be effective time and again. Next up on our list is the use of laryngeal masks. These devices are placed into the back of the throat and they create a seal around the larynx. Unlike intubation, laryngeal masks don't go directly into the trachea. This makes them a less invasive option, but they still provide a secure airway. They're commonly used for surgeries where the patient is breathing on their own, but they can also be used as a backup plan when intubation isn't possible. Now let's talk about fiber optic bronchoscopy. This is a technique that uses a thin, flexible instrument called a bronchoscope to view the airways. The bronchoscope is inserted through the nose or mouth, and it allows the healthcare provider to directly visualize the airway and lungs. This can be incredibly helpful in assessing difficult airways and guiding the placement of an endotracheal tube. While fiber optic bronchoscopy requires more skill and practice than some other techniques, it can be a real game changer in certain situations. But let's not forget about the importance of good old-fashioned clinical skills. Sometimes, the best tool in managing a difficult airway is a well-trained healthcare provider. Being able to recognize when a patient's airway is at risk, knowing how to position a patient for optimal airway alignment, and being able to perform maneuvers like the chin lift or jaw thrust can all be crucial in maintaining an open airway. And of course, there's always the need for vigilance and preparedness. Having a difficult airway cart on hand, equipped with a variety of tools and devices, can make all the difference. This includes having backup options available, such as alternative laryngoscopes, different sizes of endotracheal tubes, and emergency airway equipment like cricothyroidotomy kits. In conclusion, managing difficult airways is a multifaceted task. It requires a combination of techniques, equipment, and clinical skills. And while each case is unique, the goal is always the same: to ensure the patient can breathe safely and effectively. These techniques, while not foolproof, greatly increase the chances of successful airway management. But the world of healthcare is constantly evolving. What are some emerging trends in airway management? In this age of rapid technological advancement, It's no surprise that airway management is also benefiting from the tide of innovation. We're seeing a wave of new technologies and approaches that promise to redefine the landscape of this critical field. Take, for example, video laryngoscopy. This tool is gaining traction for its ability to provide a direct view of the larynx, making intubation much easier, especially in difficult airway situations. With a video laryngoscope, healthcare professionals can see the vocal cords and surrounding structures on a screen, reducing the need for blind intubation. This could be a game changer in emergency situations where every second counts. Another exciting development is the use of ultrasound-guided techniques. Traditionally, airway management has been a largely tactile skill, relying on the practitioner's ability to feel their way around the anatomy. However, ultrasound technology is changing that. By providing real-time, detailed images of the airway structures, ultrasound can offer a roadmap for intubation and other procedures. This can help to minimize complications and enhance patient safety. But it's not just about the tools. There's also a growing emphasis on multidisciplinary teamwork in airway management. This involves anesthesiologists, emergency physicians, intensivists, and others working together to ensure the best possible outcomes. It's a recognition that managing difficult airways often requires a broad range of skills and expertise. And let's not forget the role of training and education. With these new technologies comes the need for comprehensive training programs to ensure that healthcare professionals are fully equipped to use them effectively. We're seeing an increasing number of courses and workshops focused on teaching these emerging techniques. So, while the challenge of difficult airways is a complex one, it's clear that the future holds much promise. With these new technologies and approaches, we're poised to make significant strides in the management of difficult airways. These advancements offer promising ways to better manage difficult airways in the future. So, what have we learned today about difficult airway situations? During the course of this discussion, we've delved into the complex and crucial topic of managing difficult airways. We've recognized that this is a scenario that can arise in a variety of settings, be it the emergency room, during a surgical procedure, or in the intensive care unit. These situations demand immediate attention and skilled intervention to prevent catastrophic outcomes. We have examined real-life case studies that brought to light the gravity and urgency these situations hold. Each case study underscored the fact that every second counts when it comes to managing difficult airways. They demonstrated that a delay in recognizing the problem or implementing an effective solution can lead to dire consequences, including brain damage or even loss of life. We've explored the common techniques used to manage difficult airways. These range from basic maneuvers like chin lift or jaw thrust, to the use of airway adjuncts like oropharyngeal or nasopharyngeal airways, to advanced techniques involving laryngoscopes and endotracheal tubes. We also discussed the role of supraglottic devices in managing difficult airways and the situations where surgical interventions like cricothyrotomy or tracheostomy might be needed. We also looked at the emerging trends in airway management. The use of video-assisted laryngoscopy, for instance, is revolutionizing the way we visualize the airway. The development of newer, more efficient supraglottic devices, and the increasing use of ultrasound in airway management, are other trends that hold the promise of making difficult airway management safer and more successful. But managing difficult airways isn't just about having the right tools or knowing the latest techniques. It's also about having a comprehensive understanding of the anatomy and physiology of the airway, being able to quickly assess the situation, and having the ability to think on your feet and adapt as the situation demands. It's about being prepared for the unexpected, because when it comes to difficult airways, the unexpected is often the norm. We also learned that education and training are vital. Healthcare professionals need to be well versed in the various techniques and tools available for airway management. They need to practice these skills regularly to stay proficient, and they need to keep up to date with the latest research and developments in the field. Finally, let's not forget the importance of teamwork and communication. Managing difficult airways is often a team effort, and clear, effective communication among team members can make the difference between success and failure. Remember, managing difficult airways is a critical skill in healthcare. It requires knowledge, experience, and the right tools. But with these, we can continue to save lives, one breath at a time.